forum. My name is Victoria Stephen. I'm serving as the interim executive director for the IHI. And we have a very, very timely presentation forum today with an outstanding opening speaker and very in-the-know legislators who will be answering some questions and discussing some issues around healthcare and particularly how we combat the HR bill impact and the state budget challenges here in the Inland Empire. It's going to take concerted effort for all of us to work together, and that's the forum focus today. Just a few little housekeeping rules before we start, or suggestions and ideas. Please put questions in the chat, and we will answer those questions or have them answered twice during the forum. Please mute yourself, audience, so that we don't have background noise impacting this. We will be recording this, and so you will be receiving the recording, the open presentation PowerPoint, and the bios of our presenters today, rather than taking a lot of time going through lengthy bios. You will receive all of that. I think that's all the housekeeping rules. So we will begin the presentation. I'd like to introduce Natalie Hidalgo. Natalie is the Vice President of Strategy and Innovation, and she's from the Inland Healthy Cities Institute, which actually, when I started researching this, was new to me. So I was very excited that Natalie could come and share what they're doing, and it sets the stage for our focus today on how communities and our legislators can work together and how it's essential that we can do that now in order to meet the challenges that we're facing. Also, real quickly, they'll be introduced more formally in a little while, but I want to introduce Senator Kelly Sayorda, Assemblywoman Leticia Castillos, and Supervisor Kurt Hagman as our legislative panel today. So we'll turn it over to Natalie and have her start. Thank you so much.
Thank you so much, Victoria and Tiffany, for having me on today. I'm really excited to share with all of you information of that our Healthy Cities Institute is doing and really set the stage here for our forum for the day. So let me go ahead and share my screen with all of you. Can I get a thumbs up that you all are seeing that? Okay, perfect. So I am a vice president with Reach Out. I've been working with our Healthy Cities work for about 8 years. And in my role, I've been able to see firsthand what happens when policy meets real life, and also what happens when there is a lack of coordination. And there's really no support to our community members. So I really am happy to share our work with all of you today and take any questions at the end. So here's just a brief agenda. I can talk about Healthy Cities work for hours, but I am going to do my best to stay within my allotted time. But Victoria or Tiffany, if you need to flag me to this, let me know. My time is near, please do. I just wanted to set the stage here for the Inland Empire. As we all know, there is 4.5 million residents residing in the IE, and we face challenges that are very unique to our region. There is projected to be 50% of the growth here in the inland region, where we only really make up 17% of California's landmass. And so if we don't start working on some of the struggles that we have, if they go unaddressed, it's only going to get worse as our population grows. For the last few years, we have seen how people have been moving to the IE. I know I see a lot of growth, a lot of new shopping centers and housing, things that are necessary. So it's not necessarily a bad thing, but we do need to make sure that we have the infrastructures in place to help our community members as this growth is happening. And we also know that when there are changes to where we're investing, and our community members, they don't think to go to Sacramento or to Washington right away. They turn to their city, they turn to the community organizations where they're getting support, they turn to those trusted leaders to be able to find the support that they need. And if I could just label, or if I could describe the Inland Empire in one word, I would probably use the word resilient. And I wish that we didn't have to be resilient, though. I know that historically we're an underfunded area, and with that comes a lot of challenges, and we need to work even harder to try to fix those challenges, like our poverty rates, which then cause chronic disease susceptibility, which then cause a health workforce shortage. These are really big issues, and I know that together, working as a cohesive sector, we can work on these issues and we can solve them together. Just to kind of share a little bit about the Ellen Healthy Cities Institute. Many people think that when we talk about healthy cities, it is health programming, eating healthy, and moving your body, being physically active. And it is those things, but it's also more. And I'm not saying that nutrition classes aren't great, because that's where my career started, was teaching nutrition classes. But it's just a piece of what the work that a Healthy City initiative does. The Healthy City Institute is about preventative care, and it's about creating community cohesion and bringing people together. So to jump in about our Healthy City initiative, we support our cities and communities. I know it's the Inland Healthy Cities Institute, but we also work with communities because we have a lot of unincorporated areas in the Inland Empire. And our focus is to convene cross-sector partners, use data to identify what priority health issues there are, and more than anything, to elevate resident voice. So we are really working to translate policy into implementation. We don't come into a city and tell them what they need. We are very careful to ask and to listen, and then build alongside the community. We remain culturally responsive. As we know, there are different needs in different areas, and there are different populations in different areas. So we want to make sure that our approach is driven by the residents. And we believe in the public-private partnership model. We think it's important to have the support of a city as well as a nonprofit partner, because we're able to remain flexible and create change and move the implementation a little faster. Healthy cities create conditions that make health coverage usable. We don't provide the healthcare, but we make sure that there is coordination and access around it, and that we're remaining responsive at a local level. So again, I'm going to go pretty fast on these slides, but if you have questions, let me know. Our focus is really to be community driven. So at the start of each program, when we're working with the city, we participate in a series of town hall sessions where we hear from the community as to what the most important issues are and where they want to prioritize. That can look like environmental changes, health and well-being, focusing on arts and culture, focusing on safety, focusing on the economic prosperity. And these aren't siloed programs, they all work together, because health isn't just what happens at a doctor's office. It's what happens in your community. It's what you're being exposed to every day. And all of the little things have a part in how we show up and how our health is impacted. I do want to focus in on this community leadership component of the programs that we offer. We have a leadership academy, and This Leadership Academy is really to work with community members and bring information to them so that they can create change in their community. They're the mobilizers, whereas we're just the connectors. I see us as connectors. We're able to work with them, give them skills on communication, and just sharing messaging. We bring presenters and resources so that they have a toolkit of information that they can share with others. And they take that information and they can share at the school where their children are, or they can share information at their churches, at whatever place that they have a sense of community, a sense of belonging. This is what it's all about. So I would say that that is the secret sauce, if I may, to the work that we do, is working with these community champions to create change in the community. And I'll share some examples of what that looks like a little further. But our focus is really to create community cohesion. We know that there is a lot of people living in isolation. A lot of people are feeling alone. And I think that that is something that came out of the pandemic. A lot of people just aren't really exposed to, or we've lost practices that we had prior on reaching out to each other, on picking up the phone and calling each other. So we really do focus on creating that community cohesion, and this doesn't just happen. It needs to be nurtured, and it's to create trust in our communities, because that really is at the heart of everything. There are many community members that we talk to, and when they want to create change, for example, in their city, they don't know who their local leaders are. If they don't have trust with them, it's really hard for them to go and talk to them. And I would also say that there's a lot of fear in going to talk to government. People feel like they don't know how to go to a council meeting and make public comment. Like, these are things that we hear from our community. They're not sure what the process is. So sometimes it's about sharing what that process is, exposing them to a council meeting, to a supervisor meeting, so that they can see what the steps are to creating change in their community, and just making sure that they feel comfortable with being able to do something like that. Because like I always say, we can only change what we know, and what we don't know what we don't know, right? So if once we learn about something, then that's where we can start creating changes to make an impact. And I just want to emphasize that it does take a village. We need to have a healthy city ecosystem, and everybody on this call is a part of this ecosystem. This is really creating the support that allows for the flexibility and mobilization of resources. None of it works without all of us. And like I said, I just see us being a connecting point and really bringing people together. There's our elected officials that are on the call today, and our managed care plans and other CBOs. So we really all need to work together to be able to bring these changes to our community. I wanted to share an example of a campaign that we're currently working on and implementing in the Inland Empire. This is called our Aquí Entre Nos campaign. So through this campaign, we work with our community leaders to ask what they were hearing from people, and what services were needed. So our Aquí Entre Nos campaign is something that came from these conversations. There was a lot of people that needed support with their Medi-Cal applications. There was people that needed support with basic needs. There was people that need support with mental health. That's something that a lot of people are needing support with and don't know where to go to get access. So we created these cards, and I know that they're upside down, but they're meant to be folded. And when you open them, there's information. They're also created in both English and Spanish for for this presentation, I just pulled the English versions. And these are two of 6 campaign cards that we have created. The Aquí Entre Nos translated means just between us, because we know that in our Latino families, with our Latino families and our culture, it's not something that people just share about, like needing mental health support, or you're not, gathered and you just talk about your medical application that you need support on. These conversations tend to happen in private. They tend to happen with your bestie, your comadre. And so we have trained our community members, not experts in any field, but they're experts in their field. We have trained them to be able to hear what if it's like something that triggers a conversation, and that they're then able to share these cards, that they're able to share the support that they need. So there's a big difference in when a trusted messenger goes out and gives the information versus a CBO, for example, where if there's no trust. Once you establish trust, it's a little easier. But the message does land differently, I think, when it's someone that you trust, someone that you know, when it's your friend. And so this is where this campaign came from. And like I mentioned, they're in English and Spanish. We have cards if you all are interested in ordering some. I have the link there. I'll put it in the chat as well. But our hope is that people will be able to gain resources and be able to access them as it comes up, not having to go to a office somewhere and having to fill out applications. We're able to help them basically immediately so that they can get that support. I wanted to share also a case study, a specific city that we work in, of Jurupa Valley. We do a lot of work in Jurupa Valley. We have invested, I would say, 13 years of the work that we do in Jurupa Valley. And I just wanted to share some of what has come out in the city. So we were previously unincorporated, and we are now the Jurupa Valley city. We used to be the newest city. I think we're the second newest city at this point because somebody else incorporated last year. But through our time working with Jurupa Valley, we have been able to do a lot of art and green space projects, community programming. And I really want to focus in on these 4 ordinances that we were able to pass, because this policy change started with community engagement and listening to what our community needed. There's one of them being the smoke-free multi-unit housing ordinance and smoke-free spaces. So it was brought up that we didn't have a policy like this in our city. And what this ordinance did is it basically said that people were no longer able to smoke in public spaces such as our parks. That wasn't a thing prior. Or at our cafes if they had outdoor seating, for example. So it really created the protection for our families to be able to go to a park and not be exposed to secondhand smoke, or for families that live in apartments, that they not be exposed to secondhand smoke through the vents in their community or their complex. And I also wanted to share that we have been able to leverage additional funding in the city due to having a Healthy City initiative. And the city manager, Rod Butler, told us that the work that we do is able to reach people in the city that they weren't able to reach on their own because of being a government entity. And that is really the power of having a trusted community partner and having a program that can create sustainability, because people don't want to invest in a year of a program that's going to be there for a year and then disappear. They really want to invest in programs that are going to last and that are here to stay. So why do healthy city initiatives work? Um, I just want to focus in because we're talking about healthcare and health access, that community members with knowledge and skills lead to healthy lives, and they reduce the burden on an already strained healthcare system. We're able to uptake more resources. We're able to mobilize the community and build trust for engaging more people together and creating a sense of pride and, again, like community cohesion. And really focusing on the lasting effects that are present in a healthy city initiative, rather than short-term relief of symptoms. I feel like oftentimes nonprofits and CBOs are seen as entities to fill gaps when funding is at risk. And while we could fill gaps, we can't replace our systems. And so it's really important to have a space for community members to be able to share what is going on, so that we can take that information and share it with our legislators, for example. They need to know what our real-time data is. They need to know what our honest stories are, to be able to illustrate the impact that investments can make. And with that, I just want to close and say that it's really important for us to embed cross-sector health as part of our governance model. We need to invest in our healthcare systems. We need to invest in health overall, really look at the prevention and the upstream strategies that help with that. It really costs less than having to go to the ER to get access to health when it's too late, unfortunately. So like I said, it's the job of everyone here in this space, to make sure that we're able to create those changes. We're able to work with our community to create that long-term impact of creating policy changes, whether that's an ordinance, whether that's something bigger with our senators and assembly members' support. But in all, it really takes a village. It takes all of us. And just sharing my information there on screen if anyone would like more information or to connect. And with that, I just want to say thank you again to Victoria, and I will take any questions.
Thank you, Natalie. That was really interesting, and I really liked all the different things that you've been able to do within a city structure. And so are there any questions, Tiffany, in the chat for Natalie at this time?
Yeah, so we have one about how does a city or a CBO develop a healthy city initiative?
Great question. So like I mentioned, ourselves and as a nonprofit reach out, we have basically created this program to walk alongside the community to identify what the highest needs are, what the priorities are for the community, and we create a strategic plan. So I forgot to mention that in Herpa Valley, we're actually Robert Wood Johnson Foundation Award winners. So that is an exciting title, exciting thing to have in Herpa Valley. And we also developed just last year a citywide strategic plan that we've been able to put together with the help of our partners. And I also want to say thank you to Leticia Castillo because Madison is part of that strategic committee in Herpa Valley. So in building a healthy city initiative, it's not, I'm not going to say it's not easy. It's not easy. But it is very important. And like I said, it takes years of investing in it. And we are happy to work, whoever asked the question, we're happy to work with you to see how we can support your community and create this healthy city initiative, because it really does take community input and then create a plan. Ours is a 10-year plan for Herpa Valley. But again, this is not a one-size-fits-all model. It really is created for the community that we're working with.
Thank you.
Thank you so much, Natalie. We have another question in the chat as well. Have you considered partnering with Blue Zones?
Also, great question. So we heard about blue zones. For those of you who have heard about blue zones, I know they're doing a lot of work in Riverside County at the moment with different cities and communities. We would absolutely love to partner with blue zones. We have our NIC conference. I'll share some information about that on the chat as well. That's coming up here in June. And I am hoping that we can maybe bring blue zones and the Inland Healthy Cities Institute and a few other frameworks that are out there that in the IE together to be able to see how we can support one another because I don't think it's helpful to be in competition with one another. Not saying that they are in competition, but I do think, like I said, it's all about investing together and creating change. And I think all of our communities can benefit from that.
Thank you so much, Natalie. And we don't have any other questions in the chat.
Thank you, Tiffany.
All right, thank you so much. That certainly set the stage for some things that we're going to be discussing, and certainly gave it an opportunity for some food for thought, no matter where we are living, to look at what's happening in our communities and what we have and what we're missing in order to create a healthy city and a healthy community. And this is certainly, Christy Gross, thank you. Because she just popped in and said, plus the changes that are to come. And I think that's why this is very timely. We don't know exactly the impact of what's going to be happening, both from the federal impact and our state budget. And that's why we really need to look as at communities and how we do something a little bit more innovative and not just looking for somebody else to fix it for us. We're going to have to start fixing things ourselves. So with that, I'm going to introduce Alex Bravo. Alex has been working with us and is a member of the IHI board in partnership with Melina for many years. And Alex is going to be our moderator for our next section of a discussion with our legislators. So I'm going to turn it over to Alex and let her take this part. Thank you.
Good afternoon. Thank you for the very warm welcome, Victoria. And as mentioned, my name is Alex Bravo, representing Molina Healthcare and also the IHI as a board member. Today, I have the privilege of serving as your panel moderator. We have a very dynamic legislative panel joining us today, and I'm pleased to briefly introduce them. First, Senator Kelly Sayarto, who represents the 32nd Senate District, serving communities across Riverside, San Bernardino, San Diego, and Orange counties. Senator Sayarto was elected to the state Senate in 2022 and previously served in the state assembly representing the 67th district. Next, Assemblywoman Leticia Castillo, who represents the 58th Assembly District, serving Riverside County. Assemblywoman Castillo was elected in 2024 and is committed to collaboration and working across sectors to find solutions that benefit all constituents. And finally, San Bernardino County Supervisor Kurt Hagman, who represents the 4th District. Supervisor Hagman was elected in 2014 to serve the west end of San Bernardino County. Prior to this role, he served as the Chino Hills Park and Recreation Commissioner, Chino Hills Council member and mayor, and also served as a member of the California State Assembly. I want to extend a very warm welcome to our distinguished panelists on behalf of the IHI. Now, let's get into the panel discussion. I'm going to pose a couple of questions, and feel free, panelists, to jump in and share with us, what it is that you feel on these topics. The first question: how is Kenya responding to recent federal orders, especially in healthcare? And what's being done to protect state programs?
Would you like me to go first?
Absolutely.
All right. Whenever you say jump in, everybody's waiting for, they don't want to step on anybody's toes and jump in first. So
you know what? We're amongst friends here, so go ahead and step
great.
on toes.
So the first thing that we need to do is understand the problem. And we've been getting a lot of people coming in and helping us understand from their perspective in their region what the problem is or what the problems are going to be with HR1. And also, get us thinking about what kind of funding it's going to take. And that's one of the takeaways. The Inland Empire communities, the way they can help in doing this is help us with that information gathering and being a good point of contact for both us and the various entities that are out there that are trying to serve the public and are finding different problems that HR1 is bringing up. The one thing that's not going to change is the local governments, the state, local, and county governments. We have to deal with what we're given by the federal government, and so in doing so, we can, we're not going to be able to change it, but we can figure out what we need to do to offset some of these problems that are cropping up, and then attacking those problems in a responsible way that is not wasteful of our dollars. As you know, the state only has so much money, and we're running deficits every year. And so we have to make sure we're getting the bang for our buck that we need to help the most people. And that's one of the things HR1 has had some, and a lot of the problems we're finding are about the workforce requirements and things like that. And we've talked about those extensively with each of the entities that have come in and organizations that have come in with their concerns. And so there are some things we can do in the short term, but also some things we're going to have to recognize that are going to be longer term issues. And those are going to take longer term solutions and longer term commitments to funding. But we need to know what those are. And I think that's one of the most important things that the inland communities can do is help us get that, help us with that data and make sure that we're talking about real time, what we need to do to help people and what the data is showing. And also recognizing that, like the speaker before us said, every area has a different need. And so coordinating that message and being able to get those different needs to us so we understand what we need to do at the state level and at the county level, and then also at the local cities level. Because everybody has a role to play. We need to make sure, especially at the state level, that as we identify problems and see how much they cost and what they are, that we are able to put the funding in that's necessary to offset those things. But keeping in mind, every dollar we spend somewhere else gets taken away from another issue. So the communication and education piece of this is really, really important. And I'm pleased to say that we have had several meetings in the last couple of weeks, what we used to not have. And those are people that are being affected out there coming to the Capitol and talking to all of their representatives, not just the ones that represent their region, but all of them, because collectively, that's how we're going to solve this problem, is we're all going to have to get together and solve the problem or address the issues and make sure that healthcare and mental health care is all being addressed in our communities.
Thank you, Senator. I'm going to open it up to the supervisor or the assemblywoman.
Yes, thank you. And thank you, Senator and Assembly Member, for what they do for us at the state level. And I will say at the county level, not only do I serve as the county supervisor, but I'm also the chairman of IEHP. So I get to see both sides of the effect of the federal policies coming down through healthcare. So what we saw during the ramp up during COVID is a big expansion of services and at the IEHP level, and our membership grew quite a bit. And now obviously we're starting to see that membership go down. And as those healthcare benefits starts to go away being paid for, it's our county hospitals and our clinics that have to pick up the pieces at the end. So I think what the senator said is very correct, is communication is most important both ways. Not only do you need to let our representatives know what's going on, but also to the public of where can they go get services going forward. And so I know through IHP, and I know Belina has the same, and so does Kaiser, we have foundations that are trying to build up the nonprofits, trying to get the information out because it is changing. It's changing on a rapid basis of where do you go get those basic needs, but basic healthcare, mental health care needs going forward. So
Thank you, Supervisor. Assemblywoman.
Hi, thank you so much. And I'm going to kind of just say a little bit of what the supervisor and what the senator said, which is the same, kind of the same things. If you don't know, I'm a licensed mental health professional. Before I was in this role, I did work for the County of Riverside for over a decade in mental health. So with the severe persistent. So having those resources, knowing where to connect people is really important. Collaboration. I always tell everyone it's important for me to know what the issues are, right? And I think Natalie said it. I don't know what I don't know, right? So that's why it's always important for people to always reach out to my office so that we are always knowing what the need is and what is, the most significant issue within the community. That's how I will know how to best serve in my role in the legislator. So, and I think the senator said, coming up to Sacramento on a regular basis, not just seeing the people that are in your district, but as a whole, because even within my district, District 58, each community is completely different. That's the same with every district in LA. It's completely different than what we need. So I think that's important for every legislator to know what the issue is for your area so that they make right decisions when they're up there as well, not just for their area, but for as a whole California.
Thank you, Assemblywoman. Next question. If federal funding is reduced, how will programs like Medi-Cal for All continue? And how will the state support people who may lose their Medi-Cal coverage, but still have, for example, a chronic condition that needs to be managed regularly? And I'll open it up to the senator.
Okay, I will go first again. First of all, we have to understand the Medi-Cal problem. We spend $190 billion a year on Medi-Cal, and that only serves half the population of California. And California's share of that is they're looking at $50 billion this year, but it keeps going up, and it's going up at a faster rate than anyone ever imagined. So that points at a couple of things. One of them is need, and one of them is our capacity to serve. We only have so many hospitals, and the hospitals through Medi-Cal are not being reimbursed at the rates that can keep them alive. And there's a real funding imbalance in the need out there versus the other. Nobody's being told they can't, or nobody's losing their Medi-Cal benefits. What they're losing is the process to make sure that they keep their benefits, or they're losing the ability to have it completely free for those who can't afford to pay. I think it was a $30 a month premium. They've had to adjust it, and they have to adjust it because the current economic trajectory for Medi-Cal is unsustainable. And what they thought was a $6 billion complete total program 3 years ago is a $13 billion program going even higher. And that is taking more and more resources and creating a situation in California where we are running huge deficits now, and that will catch up with us. So we have to figure out a way to get people, number one, back out into the working environment that they want to be in. And that means we have to have more economic opportunity here in California. We can't chase businesses that provide great jobs for people away. We need to be attracting them so that they can come in and those businesses can give them health care and start moving people into that space. But we also have to create mechanisms for people to get through the process that has been laid out for them by the federal government. And like I said, we cannot change it at the state level. What we can do is try to find ways to augment what we're doing. And in this case, if it's a process issue, there are some avenues that I've talked to people about that, when you're short manpower to process or have outreach, we have, a lot of companies use interns and they use fellowships and things like that. We have a lot of college students here in California that want public education or public administration degrees. And what better way to get them involved than to get them involved at a level where they can actually see what problems are, what people's conditions are, and actually be able to help them. And so there are probably a lot of creative solutions out there. But we need to be able to explore what those are, find out how much they really cost. But the one thing for certain is if we're talking, when I say outside of California's borders, I don't mean national or internationally. I'm talking about just in the United States. If we have a healthcare system that has everybody come to California to get on Medi-Cal, we're going to wind up going broke. And we just can't have that. So we need to enable people to be self-sufficient because that's where most people want to be. And but we need to provide mechanisms and provide an environment in California that actually creates that opportunity. And so, we will continue to work with the various agencies, just like the Inland Empire communities, that are helping us understand the depth and breadth of the problem. And then that way we can come up with creative solutions. And if they need some funding, we can try and provide that funding, although you're competing against a lot of different interests that are all very, very important, but they're all competing for the same dollars. And that makes it really, really difficult. So it's going to take some creativity on everybody's part and an openness and willingness to actually face what the problem is and what the realities are.
Thank you, Senator. I'm going to open the question up to the Assemblywoman.
Thank you. Based off what the senator said, I don't think I can add anything else aside from what he said. I think some of his suggestions as far as the interns and whatnot would help with that workforce, as far as letting them get into an area that they want to be in and help in that aspect as an intern, while they're in school or whatnot. Those are things that are very helpful, if they're having difficulty with trying to. I know the big issue is, what is it, every 6 months or whatnot, having to reapply. And my thing is, I see the impact that they're saying they're going to have regarding that, but there's other ways we can look at it. Like maybe that'll get people off that aren't supposed to be on it, right? Because we have to also remember that there is some fraud and abuse in those aspects. And, maybe this is going to weed out a lot of and free up some of those monies that shouldn't be paid out to people who shouldn't have it, or to have services that they shouldn't have. And now I do look at the seniors and the vulnerable populations, which, yeah, we do need to make sure that they're taken care of. But as the senator said, maybe we can have people in place, like interns or whatnot, that can help with those applications and make sure that they're filling them out and getting them in on time so that they don't lose any services. I really don't see how people would lose services if they are supposed to be on them, right?
Thank you, Assemblywoman. And Supervisor, anything that you would like to add?
Probably not much more to add, just that there is going to be some transition. I've lived, like you're introduced, I've been around for a while now at the county, and for 12 years sitting on IHP board as well, and seeing how many more people were added to our healthcare system due to the federal policies. And now see that, that's going to be changing again. And what it does, it changes the burden of who's picking up the tab for a lot of this. And now a lot more people go back to the emergency rooms that used to be, taken to their doctors and such. And we're more the operators on the county level. So we're going to, continue to try to work with our both state and federal legislators to explain the situation, what we have going on. Here's our data, and try to advocate what's best for our residents here in the counties.
Thank you, Supervisor. The next question, what steps are being taken to protect social safety net programs that support community health, like senior centers, like senior services, food programs, funding for local nonprofits and organizations, and education? And I'll open it up to our Assemblywoman.
Thank you. So I am the Vice Chair of Human Services. So, I see a lot of things that come through that committee, and I think it's really important to evaluate, and really pay attention to some of these bills, legislation that's being, put forward to make sure that, the right programs are getting through and that money isn't, going to programs that aren't going to be helpful or beneficial. I've seen a lot of things, especially in my role as a therapist and, in county mental health and working with nonprofits. I've always noticed that throwing money at things without any consequences or any real numbers and seeing how it works just doesn't help a lot of times, right? There has to be something that is really going to help the people. And, so for me, that is something that's important. I think, again, seniors, children are vulnerable populations. Those are some of the people that I worked with. And so we always need to make sure that there is going to be programs available for them and people to help them through these difficult times because, sometimes there's just uncertainties. So we need to make sure that they're taken care of.
Thank you, Assemblywoman. And I'll open it up to the Supervisor.
Oops, I'm trying to there we go. Try and get me off mute there. No, it's a great question, and I'm excited actually. A lot of this is going to be a lot of negativity because anytime funding's tight, I think things are going bad. But we're doing a lot with what we have on the local level. So one of the big things with our foundations, we started off really empowering our nonprofits. I went to speak in front of education that we're doing with the foundation to over 100 groups just last week alone. And I know a lot of them went up and visited our legislators up there a couple of weeks ago in Sacramento and went out and talked to them and basically empowering them and teaching them how to go for resources and also to really make their nonprofit stronger as they go through because they are the communicators for our residents in a lot of ways. And also on both the county side is that we're really kind of growing our infrastructure. Infrastructure means since we have such a very large county that's a lot of rural areas, we have now invested into mobile clinics, RVs that go to people and communities that we can go out and bring those healthcare services to them on a local level. So access, I think, is extremely important. And one of the things we all learned through COVID was there's a lot of things we could do online now. So we really empowered the video checkups, the nurse hotlines and other things so we can have access to healthcare a little more easier than actually having to go to a doctor's office for everything. So even though there's a lot of negative news in the healthcare coming down, there's also a lot of positive signs that we're going forward that we could use that to capacity build both on our own systems as well as with our nonprofits to keep going out. And with the introduction that we had with the Healthy Cities, that's important as well. If we could take care of disease and illness on the early stages, it's a lot cheaper for the system overall. And if so, again, that communication, outreach, and access, it all becomes important. But it will be more challenging with less resources as we go forward, but we'll do the best we can with what we got there.
Thank you, Supervisor. And I see that the Assemblywoman has her hand up.
Yeah, so I just wanted to add that I do have a bill, AB 1717, which is to incentivize the mobile dentistry for seniors, low income, and children to be able to, the return rate is very low, almost nothing. And so it's just to be able to provide them more funding to be able to do the mobile services. There's a lot of people who can't go, seniors who can't actually go somewhere. So that is just something to help them. That is AB 1717. So I'm hopeful that bill will get through and help the dentistry because that goes a long way as far as health. as well. That was
I
it.
love that. And in the Inland Empire, there's a lot of rural areas. So happy to hear that services will be taken out to the communities that need it most. Thank you. Senator.
Okay, thank you for that. And also to the Assemblywoman's bill, that's a great idea, right? I hope it gets through. I really do. When it gets to the appropriations in their house, and then it comes to the appropriations in our house. We are fortunate in our appropriations that we have Senator Cervantes, the chair, and I am the vice chair. So we have full Inland Empire representation. But as I was talking to her yesterday, she was she was telling me, because I was telling her there are a lot of people excited because you're the chair and I'm the vice chair of appropriations. And she says, well, they need to be moderate, they need to understand that we have constraints and so yeah, there is that. I am also on budget. We have $250 billion in our general fund. In addition to that, we spend another $137 billion on education. It is hard for me to believe that with all these um, nonprofits that are out there trying to help us, trying to do these things, that we cannot prioritize this money so that we can do all of the above. Every year I'm disappointed at the end of the year because the things that get cut are the most vulnerable people. We have last year we had $400 million that was going to the disabled communities for some of their services. That was slashed to $200 million in favor of putting more money in the DOJ. They don't get that money back. They just wind up losing service. Those are the kind of things that we can do at the state level as individual legislators to ensure that the money that we're allocating and the way we allocate that budget gets spent on helping the most vulnerable people, making sure their programs are whole, but at the same time, working with those communities out there, the nonprofits and the others, to ensure that we are getting the bang for their buck that we need. Recently we spent a good chunk of money, $90 million. And if you look up the CEOs for those, they're getting paid $650,000 a year. Kind of hard to make the case that we're helping the most vulnerable when we're paying CEOs that kind of money. So those are things that we need to be able to make sure we're doing. And sometimes we don't have the time or resources to be able to go out in every community and make sure that every one of those entities out there are doing all that they can with the money that they're getting. And I'm not saying people shouldn't be paid reasonably for what they do. Everybody should. Otherwise, there'd be no organizations at all. But what I'm saying is we have to ensure that there's some accountability with the organizations, that we're getting the results we need from those organizations that are getting funded, so that we can either fund them more so they can expand, or we can reel them in so that we can make sure that we're spending the money on the organizations that are actually really making an impact. And also, there's the ability for organizations to consolidate when they're doing repeat, overlapping things, because they're competing and they wind up getting partially funded, each of them, and only being able to do a part of the job. Whereas if they were consolidated, they could probably do the whole job and for less resources. So there are a lot of things that we can do at the state level, but we really have to get our funding and spending in the budget. We have to make some priorities, and those are difficult for people to make because we want to say yes to everything, and yet we can't. We said yes to a few years ago. We said yes to the Employment Development Department when we needed it most, and we got ripped off for $31 billion. That's not the $20 billion that we borrowed. We lost $31 billion to fraud, from out of the country fraud. So we can't allow that to continue to happen, because tell me what we could do with $31 billion right now. We could help all of this. We could solve a lot of these problems. So we can't let that happen ever again. So we have to be careful, but we also have to be mindful of the people that are most vulnerable and need our help, and ensure that taxpayer dollars are not only going to help them, but help them improve their lot in life so that they can go forward and do the same for others.
Thank you, Senator. And the final question to the panel: how can we, as organizations and community members, best support California's legislative priorities, especially when federal policies affect healthcare and other social services? And I'll pose the question to the supervisor.
Thank you. I think just from my experience as well is doing what you're doing here on both on the local level and also above both the state and the federal, is that is you get in front of your representatives and educate us. Educate us. What are the real issues? How are things really working? A number of times, just knowing what is the best way, what is the information we have, what are the priorities from our residents, our constituencies that we represent, and really kind of make it a concise plan. Realize we can't fix everything, but we can definitely help set the priorities that are necessary in ways working collectively to try to address those priorities. And so especially when things are changed, not on our own accord, but on federal legislation or state legislation, sometimes it comes down to the counties. Okay, now let's regroup. Who are our partners that we're working with? How do we address it as a whole? What is the best course of action? But that two-way communication is extremely important to go up and really say, hey, these are our priorities.
Thank you. And I will open the question to the senator.
I'm coming on. There we are. Thank you. I think I said it earlier, communication, being able to communicate with us. And that means not only just the condition of what there is out there, but also great ideas that people have that will help improve their organization. We have a lot of people that come into meetings in my office and they say, first, I want to say thank you. Thank you for the crumbs that you sent us last year. And I tell people, you know what? Don't thank us for crumbs. Tell us what you need and why you need it, and how that's going to help us improve the condition that we're in, or the condition that some of their constituents are in, my constituents, and also their customers, the people that they're trying to serve. And I hate even calling them customers because they're not. They're people that are relying on that organization to help them. And that's the only way that we're going to be able to discern between all the hundreds of other agencies out there that need our assistance and are begging for money. But I'm okay spending money as long as that money is being well spent. And the only people that know that and also can come up with some of these, some different ideas on how to attack a problem, like I was talking about earlier, hire some interns, hire some, fellows, because fellows are like people that work in an office and they're learning, and they can do a lot of work that we don't have the workforce right now yet ramped up into, because that's what we need to know. What workforce do you need to accomplish the outreach and the being able to process, claims and Medi-Cal and claims and things like that? What workforce do we need, and how much is that workforce going to cost? Well, nobody has that number. So we need to develop that number, and that's where organizations out in our communities like this one, the one that the young lady was, the speaker was talking about earlier, those are the kind of things we need. Because when we have concrete numbers, we can actually talk about it in budget and make concrete budget allocations. So, I think, and forums like this are great. But they're just us talking. What we need is more of you talking and us listening. And so we will continue to try and do that. And we will continue to be available to do that and reaching out to our offices, not just to us personally, because a lot of times, especially from now until about July 1st, we're going to be really busy. but we have staffs, and that's what our staffs are for, is being able to continue that outreach even when we're sitting in committee for hours and hours. So please use us, and that's how we're going to try to minimize some of the impacts that we see coming down the pike, and also we can identify when they're not as much as we thought they were going to be. So anyway, that's where I think the organizations that are out there, and especially the Inland Empire's communities, can help is bridge that communication gap and education gap.
Thank you, Senator. And Assemblywoman.
Thank you. And I know I said it earlier, again, I don't know what I don't know. I've always told everyone I'm accessible. I show up. I try to be out in the community as much as I can, and my staff is out there too. Just to let people know, I think Natalie said it earlier, that people in the community don't know who to call, or they feel like they shouldn't, I want people to know, hey, I'm approachable, I'm open. I want to hear what's going on, because that's how I get to know you, the community, and I can know how I can be effective. And so I always want people to know that, I have an open door, and it's okay to come and talk to me and come and ask, because like I said earlier, I know resources. I can connect you here or connect you there. And I do have my staff as well. So it's always important just to stay involved, stay engaged, so that your legislators know what your need is, what's going on, and that's how we can be helpful.
Thank you, Assemblywoman. And thank you to the three of you for sitting on this panel and answering these questions openly and honestly. I'm now going to pass it on over to Tiffany, who has been monitoring the chat. Not sure if there's any questions there for our panel.
Hi, Alex. Thank you so much. We do have a few questions, but they're all kind of centered around some of the same principles, around effective collaboration between your offices and in the communities. Could you all give us some information on what are some of the most effective ways to communicate with your office or with you, whether it's through the district, going up to Sacramento, and how to best nurture a relationship with your district?
I'll go first if you would like. Uh-oh. Something happened to okay. I'm fine. Can you all hear me?
Yes, we can hear
Okay,
you and we
great.
can see you.
The best way to communicate with us is to start with the district office. And then if there's a legislative issue, then they can refer it to our leg team up in the Capitol. And if somebody needs to speak to me directly, they can do that. If they want to meet with me, they can schedule that. If there is a problem with the state agency, they can start working on that. And if there are great ideas that people have for future legislation, we can start developing that. But if you don't want to give people 15 different points of contact, you just want to give them one, and that would be our legislative office. And a lot of times everybody's out at events, and you can leave a message, but they will be returned. Doing email is great because that allows people to check their emails even when they're out. Yeah, contact our legislative offices. And I believe my chief of staff is online. She may be able to post the info for doing that.
Thank you. Were there any other questions, Tiffany? Or did we want to open this question up to also our supervisor and Assemblywoman?
Yeah, can
Well,
we
I'm
open it
the
up to the assembly member just because it's a little bit different from working in Sacramento versus working in your district?
I'm sorry, what was the question again?
Oh, I apologize. We're opening up for the supervisor.
Oh,
Oh, it's around how to best collaborate with your offices.
yeah, and thank you. And a couple different ways. Yeah, we do have our district office and our staff. We have community meetings, but that's more district centric, whereas the county in general has a lot of different we have a lot of different representations. So we have our own behavioral health commission, and they hold monthly meetings, for example. Our district attorney has local meetings to do their priorities. So our public health gets out there. We have 4 clinics. We have 3 mobile um, public clinics, 4 health centers. We have our new mobile RV vans and stuff like that going out to remote areas. So there's a lot of points of contact the county has with the community. As far as it comes to legislation, policy changes, stuff, that would be, our offices directly in the county. But as far as services, we have a lot of ways that the residents can find out what's going on and get those services. And I would direct them both to 2 places directly. One would be the county website, which has our district office information as well as IEHP and Molina, that's the public health care providers for San Bernardino County, to let them have their outreach to their websites as well.
Thank you, Supervisor. And Assemblywoman, is there any best practices or ways that we should communicate with you?
I always tell people, I give everyone my cell phone number and I tell them you can reach me directly. Sometimes it's not the best thing to do, but I just always want to let everyone know that I'm accessible, and people say, that's really your number? I'm like, yeah, I've had it since 1995, right? But I just always feel my district office staff does a great job at being accessible, being where I can't be when I'm up in Sacramento. So if it's local district stuff, definitely my district office, and I'm putting it in the chat, the information. And if you need to reach my capital office, sometimes you can do that as well. But I think for local issues, always my district office. I have a great team here.
Thank you so much. Tiffany, is there anything else in the chat that we wanted to pose to our panel?
Yes, we did have one other question. If there was any thoughts on how we can break down the silos that has impacted the IE, whether it be through securing funding or when it comes to securing funding and opening more necessary programs. And I'll open that up to the senator first.
All right, thank you. We have we have these various caucuses up in Sacramento. And one of those caucuses is called the Inland Empire Caucus. And it's made up basically of 19 assembly members and senators that represent portions of or all of Riverside and San Bernardino counties. And the idea is that with all of us together and our collective across the aisle political might, that we should be able to address issues that are especially apparent out in our region. The problem is getting people to attend the meetings. There's usually about 4 people, Leticia being one of them, myself, and a couple of other legislators that are on it. We're constantly missing 15 of them. We can't collaborate and work together if people aren't going to work together at our level to address the issues that we have in the Inland Empire. And we can't do it, like I was talking about Leticia's bill earlier. If that gets stuck in a bipartisan, we don't want to pass this person's bill because that's not our idea, then that's a disservice to our communities, especially out in the Inland Empire region. And so now that I am aware of her bill, I'm going to be watching that bill to see what happens. Because I think all of you, when she read it, all of you agree that a solid attempt at solving some or providing some relief for people. And but even though we can't individually sometimes make an impact, we can collectively. But we can't seem. I was the chair about 3 years ago, And we adjusted the rules. We did all these things to try to get it to a point where we can work together. People just won't make the commitment. And I think that's something that, from your perspective, you need to start leaning on anybody who's a member of the Inland Empire legislative team, that ask them, hey, what's your participation in this? Because we need you guys. We have some people that are ready to go, but we just can't seem to get them. So, Mr. Assembly Member Carrillo is the current chair. There's no reason for anybody to not be engaged in this. And yet it seems like we're pulling teeth. That's probably been one of the more disappointing things about what I found when I got involved as an assembly member and now as a senator. And that pressure comes from you guys. So start pressuring. Thanks.
Thank you, Senator. And there's a question that popped up into the chat asking, how can we get connected with this IE caucus? Is there an inbox maybe, or
No,
maybe you can direct us to a website?
Yeah, first we have to have an Inland Empire caucus that's active enough to be able to get connected to. But the other part is, our Assembly Member Carrillo is the chair, and so his office is kind of right now they're the connecting point. If somebody wants to make a presentation to one of our monthly meetings, we can set that up. But I think the last monthly meeting we had, I think we had four representatives. That for somebody who took the time out of their day to give us a presentation. It was online, but it was a presentation that was important to the Inland Empire. And I don't like that. 2 years ago, I had all of the county, San Bernardino and Riverside County directors and CEOs and everybody there to give us an update, and two people showed up, and one was only for about 20 minutes. I am embarrassed to have call everybody to a meeting like that and then not have anybody show up. And I think that's essentially, use whoever's the current chair, and that is Assembly Member Carrillo. I'll warn him that I told you all that on Monday. I think that's the best place to start.
Thank you. And it looks like some details were dropped into the chat for Assembly Member Juan Carrillo. Thank you. Are there any other questions for our panel before we move along?
No, that looks like all of the questions. Thank you so much.
All right. Now, Victoria, if you'd like to take it from here.
I will.
Can I just say real quick, thank you to everybody for inviting us to be part of the panel and listening us to talk, and especially me too long. And we just super appreciate it. And we are here to help you, and we're here to try to get things done. So all of us, and I appreciate the opportunity to be with you today.
Yes, thank you.
We appreciate the collaboration.
Yes, and thank you very much to Natalie for her information on the Healthy Cities Initiative, and thank you very much to all of our legislators. The information was really helpful, and you started going beyond the normal answers that we sometimes get about how to work together and how to communicate. And so, because we do have kind of a format when we do go up to Sacramento regularly, we do contact your district offices. We see your district representatives around in the community. And so we know many of them by first name and they know us. But it is a challenge sometimes to get to the right person at the right time with the right issue. And so that was very helpful on this IE caucus. You should warn your co-partners there, Senator, because I did not realize two things that you just shared. One, that the caucus didn't work real closely together, and two, that we could actually present to the caucus.
Yeah.
And so I had no idea that we could actually talk to you directly at the whole caucus. So we will certainly be looking at that and how we can increase our communication collaboratively with legislators collaboratively. And the same with, I'm trusting the same way with the county Supervisor Hagman, that there's a way for us to directly talk to all the supervisors in San Bernardino or all the supervisors in Riverside.
Well, we each have our own board meetings, but we also work, since we're our sister counties, we're in a lot of the same boards together. So I see my colleagues for Riverside almost 2 or 3 times a week. So there's a lot of communication there.
Okay.
And I'll warn them you're coming, okay?
So I think that's part of what the question of how do we break down silos is when we start working and talking in larger groups with larger numbers of key stakeholders who can really make change, because we have to work together as communities. And I understand that we have to find more innovative ways to solve the problems. So thank you very much for all your insights and your attendance here today and your sense of humor along with all of this. And thank you to everybody who attended today. We're it. So we need to also be all working together. If we're going to break down silos, we're the ones who have to break down the silos. We have to talk to each other. We have to commit to working together and find innovative ways to solve this. And quickly on that note, the IE CHI's Rural Health Report for 2026 will be out in a few weeks. We will send it out to all of you. You will know about it. It will be on the IE Rural Health website. So if you're not familiar with that website, it's ieruralhealth.org. And to the legislator's point, there's new data in that report that's coming out, and we will be up in Sacramento in April sharing that data for everyone who has rural. Well, we send it to all the legislators, but we will be meeting with those who have very distinct rural areas in their district. So again, thank you, everybody. Have a great weekend, and look for our 15th annual legislation forum next year.
Great. Thank you.